All right, we're back again. Here's where we're going. I've snuck this episode in on you, against your will.
Okay. Well, I
Correct.
don't know where we're going quite yet, but you did warn me.
Yeah. Well, how about this? Do you consider yourself a leader?
Yes.
Okay.
I don't like where this is
Just
going.
elucidate.
Elucidate as to why I consider myself a leader.
Is that a word? I don't even know if that's a word.
Uh, Expand on that.
Is it a word?
Elucidate.
Expand on
Yeah.
it. Yes. Do
Elucidate is to
that. Do that.
shed
Do
light
that.
on something. But
Yeah.
yeah, so I mean, I guess it depends on how you define leadership, but I tend to kind of go along more with the definition of being a humble leader. So, there's leading by example, and then which I feel like I do in this organization, especially with how I treat patients and take care of patients and lead from that regard. But then also there's an element of leadership for me that is at least where I feel like I have a strength, which is how to get people aligned and on board with an idea that we might have for the organization, whether it's strategic or whatever we need to do, is galvanizing people, right? Motivating people to want to join along in that mission. And so I feel like that's a strength for me. I'm not as much the iron fist, as you probably know, type person that just lays down the law and says this is what it needs to be. But, can we identify where we want to go, and then how do we get everybody on board, and almost to have it feel like it's their own idea as well and own that idea.
Okay. Wait, did you just call me an iron
No,
fist?
but
It seemed like it.
no. So
I take offense to this entire
no,
episode
I mean
so
it's
far.
not.
If that was a, I don't know.
You do not rule with an iron fist, but there are some people who believe leaders are just only strong-willed and by sheer will and force are going to bring people along, and force is not the way. At least I don't believe it to be. It's if people are willing participants and moving along a vision, and that's powerful.
So you're a physician, correct?
I am.
We think,
Yes.
and
Allegedly.
you are a leader, correct?
Correct.
You're a physician leader. If you put those words together, you can even hyphenate if you
Okay.
want. Here's where I'm going to go with this one is I think one of the problems with healthcare in America in current state is that physicians have abdicated leadership in healthcare. How do you feel like? How do you try that one on? How does that fit?
Yeah, I mean, I know where you're going with this, and so certainly if we look at it from a perspective of having to be fully accountable and responsible for the position that we're in, right? So we're not victims, we're players. When
Sure.
a physician abdicates responsibility or abdicates leadership, it's as much about not putting your hand up in the air or striving for something and sitting back and let somebody else take the reins. Because I think that there's a passivity that's existed within healthcare too, that those that will lead from an administrative side will fill that vacuum, essentially. Right.
Yeah.
So
Well,
no.
okay.
So said another way, are there strong physician leaders in healthcare in the United States? Absolutely. But if you look at it as a whole, most physicians, unfortunately, are more willing to kind of take a back seat and let somebody else fill that void and lead for them.
Well, and is that a feature of the system or a bug in the system? And I'll give you a hint. It's a feature in the system, meaning that over the course of our careers, over the course of my career, at least, I'm older than you, and it's not a conspiracy theory. It's just the powers that be understood that if they spayed and neutered physicians from a leadership standpoint and a free will standpoint, that they can control us. And what's ended up happening over the course of my career is that they have won. Physicians in this country have willingly sort of signed themselves up to go down that road. And it really, I mean, I'm just speaking from my own personal experiences over the course of my career. I've seen physician and leader used to be synonymous. It used to be one and the same. If you were coming out of med school, it's part and parcel of just that's how it was. my parents were independent physicians. Your dad was an independent physician. So we both come from lineages where being if it, back in the day, you go through medical school, come out, you'd hang your shingle up, or you'd join somebody else who had their shingle up, and you would be, by, sort of definition, you're doing your thing. And then what ended up happening between when I went to med school, you went to med school, we came out, is that they separated those things out and they started telling capable people, like people going to med school, that they weren't capable. This leadership thing, you don't have this. We got this. We'll take care of you. And so, I think you've seen the graphs where the number of administrators since like 1995 or 2000 has grown exponentially. While the actual providers of care, physicians, it's like a flat line. And again, that's not a bug in the system. That's by design. And I think I'm sort of connecting the dots here. I'd say I'll go back to back when you and I were going through our residencies in particular. Who is more of a leader than a surgeon in an operating room? Like, tell me a scenario. I mean, maybe a high-ranking officer on a battlefield or something like that. But in the OR, there are times where things aren't going the way you want them to, and there's no way out. Like, it's on you. And so,
Yes.
I feel like it's sort of like it is offensive to me when people out of the same mouth will say, you guys, whatever, you're incapable of leadership, and yet these operating, it's not just operating, I'm just using that as a specific example, is in these settings, there's no greater sense of ownership and accountability than a surgeon in an operating room. Does that sound anywhere near accurate?
Yeah, no, that sounds accurate. And I think, the layer beneath that in general is, as defining leadership is having to take the failures with the successes, right? And being ultimately accountable for those things. And there's discomfort there that is real and you have to process and sit with, because again, there's not a single surgeon that exists in this world that's been practicing that hasn't had that moment in an operating room where it's kind of like, oh shit, now I need to start thinking through what am I going to do here, because this isn't going exactly as planned, right? So that's a core essential trait of leadership. So anyway, yes, I understand what you're saying when it's like, oh, but don't worry, you don't need to lead here, under the guise of this is going to be better for patients. You just take care of patients and we'll take care of everything else.
Yeah, exactly. And I think, part of where I'm going, not to make this all about Advent, but I would say, the rules that have been created over time would suggest that, not only are physicians not leaders, physicians know they can't, finance and business and it's so complicated. You can't do it. Yet at the end of the day, for me personally, I'd say the medicine side of things, I had to go to medical school and residency to learn all that. Okay, great. And then you go out and then you learn by doing. That's how you do it. The business side of things, I've literally never taken a single business class in my life. Yet the lessons I learned by taking care of patients and basically all the thousands of reps of figuring it out one patient at a time, carried over really very nicely to trying to figure out, business problems, if that makes sense. And so I guess what I'm trying to communicate is the word on the street is inaccurate. And yet all of our colleagues, unfortunately, have sort of absorbed it as the gospel. And where I'm going is it does represent, to me, the fundamental reason why the healthcare system in this country doesn't work is that physicians are no longer in power, and they're no longer. We are an accessory. We're not. People make it out to be, or us to believe, that we're an accessory, yet we're a fundamental element. And our own colleagues just sort of forget this. They somehow forget that they are actually the most important part of the system aside from the patients that we're treating, if that makes sense. And so I sometimes wish somebody, maybe I'll need to do it, it would be to slap some sense into our colleagues. At the very least, I'd say the folks who are coming into and out of medical school in particular are the ones where I feel like as time marches on, I feel like there's fewer and fewer individuals going into and coming out of medical school that have the capability to stand strong. And I don't know. It's more of just a statement. I don't have a solution, but it just seems to be a problem for.
Yeah, I mean, it's
and
not
our
a skill or mindset that's taught in medical school, or even the lead up to that, unless somebody takes a vested interest in business or entrepreneurship or something else during, college. But I mean, in medical school, the system is not set up that way, right? It's really set up to crank out physicians to be workers.
Yeah, I mean, how I've said it in the past, and maybe it's not the best analogy, but I guess to me, what I firmly believe to be true is they will sift out that what medical schools do not want are physicians who have a strong sense of free will and agency. What they want are sheep. Bottom line is what medical schools want, and this has changed over time. I'll say, because this wasn't inherently true, back in the day. But I do believe it was sort of a calculated, not calculated like some conspiracy thing, but more of we need to make sure that we can have have better control over our docs. So let's make sure that the kind of people who are coming into medicine are sheep-like. And if we see somebody who looks a little bit more like a wolf than a sheep, let's make sure they don't come in. And I think if that happens long enough, what ends up happening is you have a herd of sheep that are easily to push around, but when somebody needs to take a stand in medicine and in healthcare, there's nobody left to do that at this point because we've all become sheep. And so I guess it's more, again, I don't know, I don't have a solution. It's more of a comment on maybe the question is what is the solution for this?
We're doing our best job of making an impact and growing our organization, which is physician-led, and where we look to our surgeons in the clinics along with their team to be leaders, and so that's an expectation, and it's interesting because I mean we're in the process of during the earlier growth phase, it's more of a top-down organization, and eventually you get to a certain size and scale where that's not doable for many various reasons, but really we need leadership out in, I don't want to say the trenches, but just, out in the field, right? Where decisions are happening every day, where we're impacting patients' lives every day. And so we need surgeons to show up as leaders. We can't have passivity, as well as the medical ENTs and their team, right? To make sure we're treating as many patients as we can in the best way possible. So.
Yeah, no, it makes sense. I mean, I guess to me, we can't change the world outside of our domain, but we can try to operate in a manner that's consistent with what I just said. Is that you've heard me say this for probably day one. Is that in this organization, we don't just need strong medical staff leadership. I demand it. Our patients deserve it, and it can still be. How do you say this? If we can do that and maintain that, everything else will take care of itself. And if we can't do that, everything else, nothing else really matters. And when I say that, what I mean is I go back to some of the things we've talked about in some of these previous episodes is the most important thing for this organization to be able to do is to deliver the kind of care that our patients deserve. And the only way that's going to be possible is if we have strong leadership in our medical staff, strong surgeons in particular, who are helping to drive things forward. And so I guess how we will attempt as an organization to change this problem is as we bring surgeons in, it's trying to empower them, not disempower them, that kind of a thing. Now, The other side of this coin, though, for us, and it is a balance, is as much as we need our surgeons to be strong and powerful and advocates for their patients, we also need to be delivering consistent care through our organization, which means, we call it our proven clinical process, which is there's a model of care that we follow. And if you, as a provider, feel like you can make it better, then the goal isn't just to tweak it so you can do something slightly better for you. The goal is to prove it, and then let's incorporate that into our model so everybody can do that thing. And we've done that, more than a few times.
Yep.
Through the years, and the intent is in a forward direction. We're going to continue to do that. So I guess where I'm going is, at least in one organization, the one that we both work for, there's the part of our DNA demands strong medical staff leadership, which doesn't guarantee, absolute actual success, but at least it gives us a chance at that, if that makes sense. I mean, I think I do, look and think about some of our colleagues who are in, various places, hospital systems elsewhere, where the actual medical staff leadership is just either deficient or absent. And I don't know, basically, if you think about one of those situations or those sorts of settings, I don't mean to be doom and gloom, but I'd say I don't know that there's a clear pathway forward. If by intent the medical staff has been disempowered, by what means is it possible for a medical staff to become empowered? And I think the honest answer is, once you hand the keys over, you're never giving them. You're never going to get them back. And unfortunately, many of our colleagues have handed the keys over, and a lot of the times it's like they're, whatever. The people who came before them handed the keys over, and now they're sort of stuck in the passenger seat. So yeah.
So how do we make this more of a rosy ending?
I think first step in a rosy ending is admitting we have a problem to begin with. And I don't know that, I'll kind of take this slightly different direction, is physician burnout in this day and age is high or low?
It's high. It's real.
It's super high. And it's getting lower or higher? It's getting higher. And I think it's the same thing. I mean, I don't know I don't think there's any daylight between the thing we're talking about and this physician burnout kind of a thing. Because when you, generally speaking, at least what you put down on your application when you went to medical school, which was that you were going to go into medicine to do what?
To help people, to serve others.
Thank you. Yes. All right, that's the stock answer. So good, you still remember that. So yeah, you and our colleagues went. We go into medicine to help people. And we've talked about it in previous episodes. So how can it be, if you have thousands of people who are going into medicine to help people, that they feel disempowered to help people? The question isn't how could it be? It's more of a how could you create a situation like that and not, I'm using a double negative, isn't a guaranteed destination for people that you're putting in that situation burnout? Does it make sense?
The current situation.
The current situation, meaning you're taking people who signed up for one mission, which is to help people, and then you're putting them in on duty in a manner in which they are not capable of helping as many people as they should be able to. I don't know if I'm making any sense.
Another elements being there is pressures and responsibilities outside of actual patient care, right? And the amount of time and effort that is spent taking care of patients versus not, administrative work, et cetera. Mm-hmm. And then the other kind of core component to this is lack of feeling free to practice medicine in the best way one thinks is possible, lack of autonomy, lack of control. So that's a big dissatisfier for many physicians, right? Even when people think they know what they're signing up for, oftentimes it's not the same thing that they think they're signing up for. And so it's the reason why many of my colleagues who are part of larger systems, I'm not going to go into names of systems because I think this is pretty ubiquitous, but when I hear them talk about their job, it makes me sad. Like, it makes me sad. And
No,
it's
I
just,
agree.
you know, there's such an emphasis on when can I be done, or this, sucks, or, it's just a grind, and they're just living day to day to get to the weekend or whatever it might be, right? So it's saddening. Yeah.
I hear you. And you mentioned EMR. EMR has of course made your life profoundly better, correct? EMR, electronic medical records, which has been it's a mandatory component of the healthcare system. So tell me tell me the thousand ways in which an EMR has made your life better and the life of your
So
patients better.
unlike you, I'm still young enough where I didn't really come into medicine and practice
Yeah.
in a non-EMR setting. The only place that I did is my intern year. I was at a county hospital in Oakland, California. That was partial EMR, partial writing. But otherwise, I've only known an EMR. But there
Sure.
is a lot of what was proposed and is believed to be something that is supposed to make one's life simpler, more efficient, and be more effective is not panning out that way for the majority of people who deal with EMR.
Yeah, which I guess, but those bureaucrats in particular who are so enamored with it, they don't care about your pain. So I guess I'd say, well, and so EMRs have been around for a long time at this point. Um, I was thinking about this the other day. If you think about technology in medicine, like an EMR as a specific example, and you think about the technology that exists in the world outside of medicine, where outside of medicine has technology actually created a greater burden and added nothing to it? Like if you think about think about your phone, which used to be a computer, which you know what I'm
Right.
saying? You think about all of those things, and I'd say you want to understand. Why we have as many problems as we do in the healthcare system is everywhere else in society, technology makes things better. But in medicine, miraculously, technology has in many ways made things worse and more burdensome and has created an even greater barrier between providers and their patients. Most of the time in this day and age, if you go to see a physician or a nurse practitioner or a PA, what you're seeing is the back of their head or the top of their head as they're clicking away on their computer. So, I'd say I do feel like that's not a great advancement. And I understand now there are, there's sort of starting to be AI technology and other things to kind of start taking notes and so forth
You
and
took the words out of my mouth. I
and
was
so
going to
on.
ask you how you think AI will either positively or negatively affect that issue.
One would think in everywhere else in society, AI will create efficiencies and improvements and so forth and so on. And I'd say if I was a betting person and you see how technology has advanced in healthcare here in this country in particular, I'd say we'll figure out a way. Healthcare will figure out a way to make AI make our lives even more miserable. I think. I hope. Maybe that's not true, but I'd say if I was a betting man, I'd say it seems like that's true for most other technologies. As a specific example, what other place in society are fax machines still the standard of care?
That's a really good point. It costs like $2 a page. Still, it's mind.
Well,
Yes.
fax machines in healthcare, it's still a thing, and so it speaks volumes. I'd say AI. I guess is there we will probably need to do an AI plugin into the fax machine, and I'm not even joking. Like literally, that will probably the advancement that comes to healthcare from AI is it'll magically do something with the paper so something happens. So it's very I don't know. Let's I'm trying to get away from doom and gloom. I'm just trying to touch on some of these things that for many of our colleagues makes their existences kind of death by a thousand cuts, more than anything. And I guess where I started down this weird road that we're on right now is talking about leadership, talking about healthcare leadership, that side of the equation, which, again, maybe I should have had a destination that we're going to head towards before I started down this road, but I didn't, other than to kind of start talking about these things. Help me. Help me feel better about the current state of things.
That's tough to do. We'll see. I mean, I think part of it too is I don't know if we'll ever get back to kind of the place where, and again, I'm the next iteration of this, but where private practice is what it used to be. Even when my dad had his own radiology practice and got to make decisions and was a disruptor innovator in my hometown, had an MRI in his office, which was like heresy, and so again, but it allowed patients access to that technology without having to go to a hospital, similar to what we do with CT scans, right? But I don't know if it'll ever get back to there, but I wonder if there'll be a re-energizing with physicians who get to pursue other elements within medicine that they enjoy that might counterbalance some of these things for them. It's interesting when burnout has gone up dramatically. It's a common thing that's talked about. It's something that, whether or not it existed in physicians before, there was certainly dogma around that, and so it wasn't spoken about, right, to a certain extent. But the number of alternate non-clinical careers for physicians and the marketing around that, and not in a bad way or a good way, just saying like the boards, that has grown enormously for physicians looking for an out or another way to use their clinical acumen or expertise in a way that's not direct patient care, right? And at the end of the day, patients are going to suffer. Care is going to go down, right? So I get efficiency, but patients don't feel heard or seen or listened to or whatever it might be that are taken care of. So I don't have a rosy answer for you. I wish I did.
I don't necessarily myself. I will say, I mean, you kind of touched on it a little bit, but I think I was just reading something. I think it was like in like a JAMA kind of publication, which is talking about the golden age. Do you know when the golden age of medicine was?
I'm going to say the 70s and 80s.
The golden age of medicine, how they define it, the conclusion was the golden age of medicine. This is talking to a physician audience, was about 10 years before you went to med school for all of us, meaning that everybody. So this is I'm going to kind of take it in a slightly different direction. Is everybody thinks about the era that just preceded them as the golden age, and what they're entering is something less than. But that's been true since I went to med school 10 years before you did, and I've got sisters who went to med school 10 years before. You know what I'm saying? So there is a bit of like, as much, maybe my trying to bring this up and end on an up note versus a down note is that there historically isn't always a glossing over of this, like, oh, isn't it all great? And it wasn't all. I guarantee you, and I've talked to your dad, and I know what my parents went through, that it wasn't all rainbows and unicorns back in the golden age. I mean, there were different problems back then. So it wasn't all hunky dory, but it was certainly, I guess, one thing I will say for the age that preceded the current age in medicine is there was greater agency over our profession back in the day. That's changed. Currently it's very we've lost that, and I think it's what I was saying before. Once you've lost that, there's no coming back. And so I do think with what we're trying to do, at least at Advent, it's just trying to preserve. I mean, I've thought about this. I literally, when we first started, it was, how can we preserve, a bit of that old school mindset with new era technology. Old school mindset in my mind is, you close that exam room door and it's trying to deliver the best care that's humanly possible. And then if you can match that up with technology that didn't exist before, then all of a sudden, I guess I'd say, let me go. I know it's more specific, to what we're doing at Advent, but I would just say very simply, Advent could not exist if not for the technology that has come into being, since we started 20 years ago. And so I think there's the pathway in a forward direction in medicine doesn't mean you have to be like a cookie cutter what we're trying to do. But I do believe that if you're a specialist, it's trying to think about the technology that exists in your specialty and how can you how can you bring that to more people? I guess is sort of bottom line. For us, it's easy because we have so many effective tools. So it kind of, I guess to me, it's like it's a very clean, clear way of doing things. I think, though, if you are in a different setting, like in a hospital, employed hospital system, I'm not quite sure what you do. I don't know how you march in a forward direction. So,
I guess we'll find out over the next 10 years.
yeah,
So
I,
something will
I
shift.
guess we'll find out.
Yes, yes. It's a ever evolving story, that's for sure.
Yeah, it is. It is. All right. Well, this was a very downtrodden minor key episode. So we'll leave our listeners to what should they do? They should gaze at their shoes. They should turn on some Joy Division.
Yeah.
They should turn the black lights on, grab some whiskey, and sing songs to the good old days.
Yeah, I don't think this will be on any medical school's recruiting webpage.
Possibly not. But all right. Well, anyway, look at the bright side. We'll come back in maybe a better attitude and better mindset and mood next time.
I'm all game for that.
Okay. All right. Thanks.